Hi guys, so in this video I'm going to be telling you what to do when you have unprotected sex. Now, people that take antibiotics when they have unprotected sex, does it really work? Does it really prevent infection? Does it really and people that also take it to stop prevents, or maybe they exposed themselves with somebody that has HIV and they quickly took antibiotics, maybe ampiclos or something. Does it really work? Does it really prevent you from getting the HIV? And does it really also prevent you from getting other infections? And what you will do when you have unprotected sex, whether to prevent pregnancy or to prevent infection or whatever you have in mind. And also going to be telling you about things you do to actually prevent pregnancy apart from taking contraceptive pills. Now, contraceptive pills is not, especially taking it for a longer period of time. I've made a video of what will happen to you. Taking the pills causes high blood pressure over a long period of time, and this postinol too and other post pill, what they do to you, how they cause infertility. If you're not on my YouTube page, just go there. A lot of videos are there. These videos are there. So a quick one, let's just get to it. What to do when you have unprotected sex, right? For preventing infection. Okay, I'm going to talk about preventing infection and also the preventing of pregnancy. So number one, what to do. First of all, as a man, you have to go and pee, right? Or also as a woman, after having unprotected sex, you have to go and pee. Now, going to pee does not make, for the women, it does not flush the sperm away. The route where the sperm enters and where your urine comes out is not the same. Okay, the sperm enters through the vagina, while you urinate through the uretary meatus. They are different places, but they are close. They are different places, so this will not help you prevent pregnancy, or it won't flush the sperm away. However, if it is a very low sperm that is of low quality, it will just flush the outer semen out, but the sperm, trust me, immediately you do whatever you're doing, the sperm has gone up immediately. Like, it doesn't take so much time. Okay, so the purpose of urinating after unprotected sex is to reduce the risk of infection. Okay, there are some microorganisms that must have found their way through your vagina. Bacteria, I beg your pardon, that must have found their way through your vagina, and it goes up urinary tract, it goes up and cause infection for you. So that's why you are asked to urinate, right? Okay, because of that area, right? So during the process, bacteria can find their way through the urinary tract and cause infection. And UTI, when you don't treat it, can damage your kidneys. You can also watch the video. I've explained how on my YouTube page. Now, that is the number one thing you should do. Go and urinate. For the male and for the female, it helps reduce the risk of infection. Now, the second thing that you're going to do is, if you are a lady and you want to prevent pregnancy, if this is emergency, you just go ahead and take a post pill. Okay, leave other things that they are telling you to take that is to prevent pregnancy. It doesn't. I'm going to talk about it on my other video, like and also the natural ways you can prevent pregnancy, but I'm talking about this emergency. Now, remember, this post pill you will take is not to be, it's an emergency contraceptive. It is not for all the time. It is emergency, so you shouldn't be having this kind of emergency all the time. Okay, if you take this all the time, it has its complications too. I've already explained it on my YouTube page. So that's the second thing you're going to do. Now, the third thing you're going to do is, let's come to the aspect of using the antibiotics, taking antibiotics to prevent infection. Now, the truth of the matter is this: if you take antibiotics after unprotected sex, it can help you prevent infection to some certain level. and there are some kind of infection it helps you prevent, right? But not HIV. Okay, now the preventing infection, maybe chlamydia, gonorrhea, it is not 100%, it might be 50%. Okay, it can help you 50%, not 100%, 50 to 70%, according to research that I found out recently, right? It can help you, but it is not 100%. Now, where this is a problem is this: when you continue using, after having unprotected sex, you continue using antibiotics, is you will get resistance to antibiotics. Now, when the actual infection comes, because that person you had sex with might not really have any infection, but then you went and you took antibiotics. Now, when the and you this becomes a habit that whenever you sleep with a woman, you take antibiotics. Now, you might get resistant to antibiotics, and when the actual infection comes, like gonorrhea comes, now when you now use that antibiotics that you've been using, it might not really work, right? Because you've gotten resistance to the antibiotics you've been taking, and while you might be taking them, nothing actually was happening to you. Probably the girl just had simple yeast infection, and because maybe punani smells, and you thought, oh, okay, this one had infection, gonorrhea, or all of those STI. No. So this is why you should really be careful. It's not everybody you sleep with that you take antibiotics, so that you don't get resistant, and none of these antibiotics will now work on a longer run. I'm going to make a video about these antibiotics. It's a serious thing. Don't look at the way I'm explaining it here. It looks like it's not serious. It's serious, right? So that's why you should also use protection. Now, let's get to when you want to prevent HIV. If you want to prevent HIV, remember I made it clear that antibiotics does not prevent HIV. If you take normal antibiotics like the ampicillin and all of those things, it does not prevent HIV, but it can help you reduce the risk of other infection. Right? Okay. Now, this is because antibiotics helps. Some antibiotics, it depends on the spectrum of the antibiotics. Most helps to cure bacteria, right? Bacteria, while HIV is a virus. Do you get? So this is why it's not going to work. HIV is a virus. Antibiotics that you're taking, those classes of antibiotics, are for bacterial infection. Okay, that is why it will not work. So what you will do when you sleep with somebody that has HIV, you just found out that most people, I've seen somebody that somebody told vividly that congratulations, you just joined the queue of HIV after sex. I don't know how long it was. Okay, so if you found out that this person is HIV positive, don't worry. What you're going to do is this: go to a nearest hospital, reports that this is what happened, and you're certain that this person is HIV positive. They have a drug they will give you called PEP. It is called post prophylaxis exposure. Okay, prophylaxis exposure. Okay, what it does is it's drugs for HIV. What it does is it goes and kills the virus if there are remnants that have not yet multiplied. Because what this virus does is, when they try to imitate your immune system and then start fighting against your immune system, and try to bring your CD4 counts low so that they can infiltrate. It's a long process though. So this is what you're going to do. Not taking normal antibiotics is not going to work. Okay, now this is it. If you like this video, share and follow for more.